A review of disutility for health states of severe and non-severe hypoglycemic events in diabetes. This presentation is based on our publication in the Journal of Comparative Effectiveness Research. We will focus on the review part of this publication, and the other presentation will cover the estimation of disutility for joint health states of severe and non-severe hypoglycemic events. The outline of this presentation. Hypoglycemia is a common side effect that people with type 1 or type 2 diabetes may experience when taking blood sugar-lowering medications. It is characterized by low blood glucose levels and can be asymptomatic, biochemical hypoglycemia, or symptomatic, including mild, moderate, or severe hypoglycemia. By clinical definition, non-severe hypoglycemic events can be self-treated by eating or drinking food items containing carbohydrates, while severe hypoglycemic events require assistance from another person. Both types of events can occur in the daytime, normal waking hours, or nocturnally, usually defined as while sleeping or attempting to sleep. Many of the classic long-term diabetes economic models, such as UKPDS model and core diabetes model, only accounted for severe hypoglycemic events. However, non-severe hypoglycemic events may have health and economic impacts for people with diabetes. The objective of the present study was to review the published literature on disutility due to hypoglycemia. I summarized methods of our review in this slide. We included studies in which diabetic patients provided utilities or disutilities for their own experiences with hypoglycemia, as well as those in which respondents from the general public provided direct utilities, such as time trade-off, for hypothetical health states of hypoglycemia. Eliciting health state utilities from the general population is the standard method for utility studies. Now, I will present results of this review. We identified 24 studies that met our inclusion criteria. Detailed results of the literature search, selection, and exclusion are summarized in a Prisma flow diagram. 19 studies elicited disutility of hypoglycemia from patients with diabetes, and 5 obtained utilities for scenarios from the general public. The adjusted and unadjusted disutilities of hypoglycemia from patients with diabetes were presented in this table. The patient's characteristics and other details of studies included in the literature review can be found in the supplementary materials of this publication. The 19 studies in patients used different definitions for the severity of hypoglycemic events, which occurred between 4 weeks and 1 year before the date of the survey or interview. 16 studies used multiple linear or mixed linear models to evaluate disutility due to hypoglycemia, with adjustments for other common diabetic complications and patients' characteristics. All studies showed that hypoglycemic events were associated with reduced health utility. However, the magnitude of disutility varied greatly, from 0.002 to 0.27. We had an interesting finding. Compared with studies which primarily evaluated the impact of hypoglycemia on health-related quality of life for diabetes, the studies which investigated the impact of several diabetic complications on health-related quality of life seemed to find a smaller magnitude of utility decrement for hypoglycemia. 5 studies elicited time trade-off utilities for hypothetical health states from the general public. The results were summarized in this table. Table S5 in the appendix provides details of these studies, including the statistical methods to estimate disutility per hypoglycemic event. The disutility per severe hypoglycemic event was approximately -0.06. and the disutility per non-severe hypoglycemic event ranged from -0.0032 to -0.0076. Discussion. Future research in health utility of patients with diabetes should include health states with common diabetic complications and different severities and frequencies of hypoglycemic events. These studies could help us better understand the impact of joint health states of severe and non-severe hypoglycemic events relative to the disutility values for other diabetic complications. Then, we can make more accurate estimates of disutility for diabetes and provide more reliable cost-effectiveness estimates. Conclusions. We identified 24 studies which reported disutilities for hypoglycemia in diabetes. All studies showed that hypoglycemic events were associated with reduced health utility. However, the magnitude of disutility varied greatly. Here is the timeline of this article. Thank you.